The pathophysiology is tuberculosis organism is a non-motile, obligate, aerobe, replicating cycle of 17 to 24 hours. It is a slow-growing one. It is non-capsulated. It is acid-fast due to the surface lipids. So, resistance to common active antibacterial agent and lytic enzymes are there. It occurs in the age, it can occur at any age group, 75% being in the 20 to 45 years. That means in the reproductive age group, the incidence is quite high. In the postmenopausal women, it is around 7 to 11%. And if primary infection occurs close to menarche, there is increased chance of genital tuberculosis and the patient will really land up with so many problems leading to infertility. Mycobacterium tuberculosis is of human type, is commonest one, occurring in 90 to 95%, and rarely bovine mycobacterium infection can also happen in 5 to 10%. It is almost always secondary type of infection in the genital tuberculosis. If the bacilli are not eradicated, the risk of reactivation, especially in conjunction with the disease, that is Hodgkin's lymphoma or AIDS, on steroid supplementation, stress or malnutrition can happen. The extent of involvement of genital tuberculosis is 100% involved in the fallopian tubes, 50% in the endometrium, ovaries 20%, cervix 5% and vulva and vagina less than 1%. The types of tuberculous salpingitis, because as we have mentioned that it is 100% genital tuberculosis involves the tube, it can be exudative in the acute phase of process. Large pyosulfings may form. Frequently, the organs contain large amount of caseating material plus purulent exudate and show few adhesions. Productive type or adhesive type. Found most frequently in laparoscopy or laparotomy, tubes are studded with tubercles and are densely adherent to the surrounding tissue. The tube wall is thickened, nodular. Eventually, the process starts healing. It results in calcification and fibrosis.